Good question.
So that's kind of freaking me out.
It is a saying that everyone uses, that laughter is the best medicine, but it doesn't take much to imagine that a little bit of laughter, a little bit of relaxation, a little bit of a funny story does put you, your whole body, chemically in a spot where you're more open to hearing a diagnosis, to exchanging with a healthcare provider.
I think it's a wonderful tool to relax children, families, but also the teams.
Humor is the most perfect way to normalize life.
En mi propia experiencia puedo decir que el humor no ha curado, pero sí que ha servido para cambiar radicalmente el ambiente que hay en una habitación, el ambiente que no solamente para el niño, sino también para los padres.
It is true that in the busy environment where I usually work, which is the emergency department, when the clowns arrive, everybody stops. But that's often on purpose, because it creates a rupture in the usual flow of stress, etc. going on.
They become less stressed, they have more hope, they have more joy, they get release. Their experience of healthcare is much improved.
There is clearly a relief of stress, of anxiety, I think also of pain.
I mean, you see patients transforming. You see a child that is sad or bored or angry being transformed into a child that is taking control of their own situation.
The stress level goes down, it's much peaceful, much better, and I think it helps the nursing staff, the patient, the mother, and I think it makes the patient's experience a totally different thing.
I'm always impressed by the skills that medical clowns have when they enter a room, when they're reading the cues and when they start the communication with child and parents. And I believe that these skills should be trained by clowns to us medical professionals because we need these also in our normal medical interactions.
We have seen that the staff don't have time, they don't have a good relationship with the patients. We have been able to build the bridge between the staff and the patients.
It's not uncommon for me to be in a room with a child and a partner having a interaction and have the doctor come to the door and see us there and say, "I'll come back."
Healthcare clowning isn't just an umbrella term. Healthcare clowning is a general yes approach, but it is made of tiny little blocks of personalization, of improvisation, of adapting to the child, to the situation, and I do think that's where the magic comes in.
They're not just clowns, it's actually an art, and it's something deeper than making somebody laugh, because you need to know when to do it, so you have to be very much in tune with the person that you are interacting with.
I think one of the things is the underestimation of their professionalism. So they are educated, they are specially educated, so they are wonderful professionals like we are also. And many of us, I think, from healthcare professions don't know about that.
I think today people might underestimate the power of being human, the power of being authentically present and human. And the clown's different is that they've got a twinkle in their eye.
People do not imagine how close we work with the hospital staff. We take the kids all the way to the surgery room and we help the surgeons involve the children into the anesthesia in a much easier way, for instance.
There is this big community out there. We are not alone. In Bangalore, we are the only group of people, a small one, who are doing this work. Now I see and I meet so many people who are like me, so I sense the belonging.
This is just astounding how universal this is. This is proof that what we're doing is working in so many different ways, but in a way all around the same magic little dust.
It's an art form that's really maturing, and a lot of great questions are being asked about the art form to ensure that we continue the work long into the future.
We are in a moment where things will evolve, and I think what is important now is to involve more and more teams in the hospitals for them to spread the word around. I think that is the way for the future.
The presentations coming from medical doctors who are giving us the technical terms of what we're doing. Us not knowing what that is, we are intuitively doing it. If we can work that closely with medical teams that see exactly what we're doing, understand this, then we won't be outsiders there anymore. We'll be insiders.
When we want to bring play in children's healthcare, it shouldn't belong to one domain. It's not about the medical people, the nurses or the clowns or child art specialists. It's about how can we share our insights, our expertise to change this world to a child-friendly environment and experience.
The rich congregation, the rich assembly made out of clowns and other healthcare professionals from multiple different backgrounds, countries, that come in to bring humanity and expertise and science and medicine together. And that is something quite unique.